Hello friends, welcome to Creative Medicine. In this lecture, we will learn about
Indications for surgical management. In indications for surgical management, if there is failed medical management, if the medical management fails, then you can do surgical management. So, in the surgical management, we have different procedures. Endometrial ablation and hysterectomy is done mainly. Ablation. Endometrial ablation is removal of entire endometrium, including the basal layer, so that the definitive treatment of uh, abnormal uterine bleeding is seen. This endometrial ablation is of two generations, first generation and second generation. In first generation, we have resectoscope method. First generation is called as resectoscope method. Second generation, there is no resectoscope required. In first generation, special training is needed. In second generation endometrial ablation, no special training is required. In first generation endometrial ablation is done under general anesthesia. Second generation endometrial ablation is done under local anesthesia. First generation endometrial ablation, here inpatient procedures are done. It is an inpatient procedure, whereas second generation endometrial ablation is an outpatient procedure. First generation endometrial ablation is less expensive. Second generation endometrial ablation is more expensive. In first generation endometrial ablation, fluid media used for distension has increased chances of fluid overload, whereas in second generation no distension media is used. Examples of first generation endometrial ablation are roser ball method, laser roller ball method, laser method, transcervical resection of endometrium, wire loop method. These are first generation endometrial ablation. Example of second generation endometrial ablation include microwave method, thermal ball method, or cryosurgery method. Thermal balloon method and cryosurgery method.
thank you and thank you for watching.